Hi, I am Dr. Kamran Khan, a surgical oncologist with 30 years of experience in cancer surgery and robotic surgery. I treat cancers in women and I treat gastrointestinal cancers. One of the things I have seen in my practice and which has almost made me very sad is that whereas very often men get cancers which may be because of substance abuse, in women the cancers are just because they are women and they have been ordained by nature to reproduce the human race. The cancers of the reproductive organs like breast cancer, ovarian cancer, endometrial cancer and cervical cancer, they occur because of no fault of theirs, just because they are the ones who nurture the future of the human race. Now two of the cancers, especially breast cancer and cervical cancer, are easily detectable and treatable at an early stage. So this is where I request all my sisters, my daughters and my friends not to lose the opportunity to detect these cancers early and to treat them. So you must undergo a pap smear every year after your childbearing is complete and even at the time of childbearing. You must undergo the cervical vaccine or give cervical vaccine to your young daughters at the appropriate age. You must enter an appropriate program to detect your risk of cancer. You must start an appropriate screening program for breast cancer at the age of 40 because that is where we see that the incidence of breast cancer increases. And also be very conscious of your own body. What are the symptoms that you are feeling? If you have any abnormal bleeding in your menses or intermenstrual bleeding, get it checked with your gynecologist. Get the appropriate tests done. Try to lead a very healthy lifestyle with appropriate exercise. The entire family is dependent upon you, your husband, your children. Try to find time for yourself to do some exercise and have the right nutrition. And remember that breast cancer lumps are painless. If you have a lump in the breast, get it checked by the appropriate oncologist. Do not be complacent thinking that it is painless, so I don't need to worry about it. That's a big mistake. Get it checked. Remember to do a breast self-examination every month, 5 days after you have completed your menses, to be sure whether you have any lumps in the breast or no. Get your cancer risk assessed. So maybe you can go sit down and look at your family history if you have other members in your family who got cancer at a young age. See the pattern, meet a genetic counselor, undergo appropriate tests. Now, these are not things which are done unnecessarily or they are expensive. You must find time because early detection really saves you from difficult treatment, from unnecessary costs. How much ever we try to subsidize it, it's one of the most expensive treatments which are there in the medical science. So undergo these tests regularly, be conscious of your body, and remember that if there is any symptom of cancer or suspicious of cancer, you need to meet an oncologist with appropriate experience or speciality in that to take you forward and handhold you through your treatment so that you have minimum cost, you have minimum morbidity, and you're able to return to a normal life as soon as possible.